Washington, D.C. is the most dangerous place to give birth in the United States if you are African American. If you are a white woman, you'll do very well in the nation's capital. We have a major disparity problem here in D.C.
Pooh, what grade are you going to?
Kindergarten.
Kindergarten! I was very young when I had my son. I was 15 years old. So I was a sophomore in high school. I was living with my mom and she was also working. Again, one more time. My social worker at school was just like, you're gonna do this. It's gonna be fine. You're gonna push through, you're gonna persevere, you're still gonna graduate on time. I lived in Southeast DC off of Morse Road, and I commuted to Northwest Washington, DC.
Route W3.
For the simple fact that in Southeast we don't have any adequate health care. So I had to travel to Washington Hospital Center, which was the next closest hospital to my home. So my commute was probably about 45 minutes to an hour on a good day.
It's terrible for kids, for the people who have kids. It's not right. It's bad.
No woman should have to commute an hour and a half or more to access health care, but that's what we find in the district. There are really a number of challenges and barriers that Black women are overcoming in accessing care in the district.
In 2017, there were closures of 2 labor and delivery units in DC. One hospital was Providence. It's my understanding that the reason that Providence closed was because of cost. Labor and delivery typically is not a unit that is a profitable unit for a hospital. The labor and delivery unit on UMC was closed by the Department of Health. And it was closed on the basis of 2 cases. One was a maternal death, and the other one was a case of HIV.
So I feel like it's unfortunate for us because we have to go to other communities to get services where we should have those same services in our community.
That's not good because we live in Ward 8, so why can't we get the same benefits that anyone else has?
The experience of being Black in America is so fundamentally different from the experience of being white in America that it translates to health outcomes. Black women are 3 to 4 times more likely to die than white women in the United States.
I think it is very easy for people who are not part of the public health and the healthcare system here in Washington, D.C. to use us as a soundbite. It is very easy also to use data that supports a national advocacy agenda because of who we are here in Washington, D.C. and the nation's capital. The data that's often used that cites Washington, D.C. as number 1 in maternal mortality is old. We're number 9, which means that we have made progress in the past 3 years where that data is published with 5-year trends.
Let's put more resources in these communities and see how they grow and how they flourish.